Sir, in Florida, we serve almost 600,000 veterans. We are the third largest population of veterans in the country. And my question goes to, I personally think the VA system is an A or a 10. But when first year I was teaching, the principal said, if you are A or a 10, where's your room for improvement? So I'm started out saying I think the system is very good. What are the recommendations would you have for some improvement? Because I don't think the entire system is damaged, as I hear. And I do think there are things that we could do. I remember when Secretary Brown, Jesse Brown, when the veterans from the Northeast came to Florida, we serviced them and we didn't get reimbursement. The reimbursement stayed in the North. So, I mean, I know a lot about the institution, probably more than anybody on the committee.
So how can we improve? Well, the first thing we can do, as you heard earlier today, there are many VA facilities that are top achievers, incredible performance, but not everybody's there. And the first thing we need to improve is to get everybody up to that same level. Second is, we say we are a quality organization, but I constantly remind our staff that there are multiple domains to quality. One of them is access and one of them is timeliness. So if you can't have access, you can't even have quality. So fixing this access problem and doing it immediately is key. Third is equity. You know, if there are inequities in the delivery system, we've got to identify them, we've got to figure them out, and we've got to make them go away quickly. So as we improve the standards of all hospitals, raising all boats up to what we know we can achieve, but also ensuring that access, quality, equity are uniform principles of how we do that work.
We had a hearing, the Florida delegation on VA this morning, and one of the recommendations, at one time, the VA could just, I guess, hire a doctor, and now they have to go through a different system?
I'm not sure what you mean. We have a process for credentialing and privileging physicians. It's not unique to the VA. Every hospital in this country will do the same thing. Our process is actually, the credentialing process is pretty good, but one of the things we're doing is we are working with DOD, because they've got one too, but it's different from ours, and trying to establish a federal-wide credentialing process. So if somebody came from DOD over to the VA, they wouldn't have to do it again. And even more important, in the conversations around telehealth, where you now got people practicing across state lines, you can have a uniform set of credentialing. That takes time. The one thing that is unique to VA is that physicians especially, but I think almost all employees have to go through security and background checks, and that takes some time. What we're trying to do, and in fact we learned a lot of lessons, if you remember last year when we had the hiring initiative to plus up the mental health workforce, we learned a lot about the speed of hiring, and the challenge but simple solution is don't wait for step A to fix before you start step B, before you start step C. Parallel process, you can cut down that time. If we don't do that, we lose people while they're waiting to get their job.
Nursing is another example that it takes so long for us to process a nurse.
Yeah.
And how do we advertise? Do we advertise just in the VA system, or I mean, how do we do it?
Well, so there's a requirement, I believe, that all federal jobs have to be posted in at a federal website so everybody can see them. But I do know, for instance, when I'm reading the Richmond paper, there's on Sunday morning, there's always ads for the VA looking for nurses there. So, everything goes into a website, but in fact, you use local resources. We also have executive and physician recruiters as part of workforce services that go out and reach out and try and find these people, and we leverage them in the mental health initiatives. They're very effective.
One last thing, we've had lots of discussions of how we get additional VA doctors into the system, and what can we do as far as, I guess, the medical, so that they can get, I guess, forgiveness on their loans
Yeah.
when they work to the VA, or whether, in Florida, for example, a lot of our interns go out of the state because we don't have the, what's the word? So they go out of the state. Residency.
Yeah.
Yeah. And so we don't have those slots. What can we do?
Well, so there's two things that you're asking about. One is, for people who have large med school debt, and the average is pushing upwards to a couple $100,000 now, if you don't have help somewhere along the line, is can we do debt forgiveness? We do have some limited authority. It's insufficient.
It's insufficient.
We've been talking to, and particularly where we want to place physicians in underserved areas, which is the real challenge. It's less of a challenge. People want to stay around where they did the residency, so in urban areas with big medical schools, it's much less hard. So we've been working with HRSA, who has the program where they pay scholarships and loan reimbursements to people who work in designated underserved areas, many rural but not all. It doesn't make sense for us to build another organization within VA to replicate that process if we're going to go that route, which I think we should if we can. We've got to make sure, but to tag on to them. They've already got the infrastructure in place. It can move out immediately, and then the other piece is increasing residency slots. VA is highly supportive of the residency training programs in the U.S. I think you heard earlier about 70% of physicians get some of their training in the VA system. We've expanded that in certain areas. There's still not sufficient, well, for mental health, it's not that there's not sufficient residencies. In fact, some of them have closed because there's not sufficient people going into them. So how does one incentivize that mental health community that more physicians would want to go in there? And that's not a question that VA can answer, but we can support the slots when we need to. I think there's the other piece of this, and it was also mentioned earlier, is how does one leverage the use of both nurse practitioners and physicians' assistants and alike, and it's our intent within the organization that people practice to the top of their license. And so I think supporting PA schools, supporting nurse practitioner programs. We've got the VA nursing academies, which are very useful for bringing people in nursing into the VA systems. And we're also now training people in interprofessional training so that doctors and nurses train side by side and learn to work as teams. And people who go through that find that is a very satisfying career move. But we've got to start that early in the training programs and not wait till they graduate and then try and retrain them to a different way of practice.
Thank you so much, and my time is up, and you've been very gracious, Mr. Chairman.